Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So I want to run this by you, a story that was in the Patch where they obtained confidential update to the governor that said positivity rates are unreliable, and this was from the scientists advising the governor, and they said hospitalizations and deaths happen too late to estimate transition rates, and I'm simplifying. And they say that community-level serology testing is really a more accurate way to assess the situation. So, as an expert, I wanted to get your reaction to that analysis.
Yeah, all those metrics, which is what every one of the things you just mentioned, are important, and they all get looked at together. You can't just isolate one out. You could, every one of those metrics that you look at, you could say, oh, yeah, this worked, this is good for here, but there's a problem with it over there. And that's what this statement is saying. They're picking on the percent positive one. That's just part of the equation. You got to put it all together. The reason why people are freaking out now is because the hospital rate is skyrocketing as we speak. In our hospital system, 25% of all the COVID patients that are in the hospital now were admitted in the last 24 hours. You know, and this is happening all around the state, all around Western Europe too. I mean, it is the indoor winter phenomena that was predicted, and the only thing that is different from the prediction is it came earlier than expected. We're not even in the winter, we're still in the fall.
There's also news that 80% of hospitalized COVID-19 patients had a vitamin D deficiency. What does that mean?
Yeah, this is from the University of Salamanca in Spain, and they looked at over 200 people. They found 80% had vitamin D deficiency. That is really quite...
So should we be taking a vitamin D pill?
No, that's not what it means. That may be, you know, you may have to get tested for vitamin D, but low vitamin D is associated with inflammation. And inflammation is a big problem in COVID in the ones that are in the hospital. So, you know, it has to be looked at. They also, in that study, I must say, that the ones with vitamin D deficiency and the ones without kind of behave the same in that particular group. It's more of a kind of a scientific anomaly. We need to look at it. And, you know, perhaps we should be screening more for vitamin D in certain groups of people.
All right, tell us what's going on with Regeneron.
So Regeneron, you know, this is the antibody company. This is the company that they have two antibodies in one infusion. And they are doing a big study with 800 people. This is the antibody that President Trump received. And, you know, he made a very remarkable and quick recovery for a man of his age and weight. You know, it showed that they had 57% less visits to the doctor than the people that got the antibody compared to those that didn't. So this is a preliminary result. We don't know if hospitalizations were decreased. We don't know if it prevented death. So, you know, this is just, it's a good sign, but this is just the beginning.
All right, let's get to some viewer questions. This person says, do you think air travel should be limited to essential emergency situations only? There is no mention of COVID spreading at the airport. I work there, and the confirmed cases with airport employees is way out of control.
Well, I don't know the last part of the statement. I haven't heard that, but you know, I believe the person if they're there. You know, we have to practice mask wearing and social distancing in the airport. They have to do it. I mean, air traffic is down drastically. You know, if it goes down any longer, I think, you know, they're just going to, you know, cover the whole thing up in a bag and, you know, come back in a year. But there already is very limited air travel. I don't think they have to really limit it anymore. There's been more studies done on the airplanes, and the airplanes are pretty safe. The real long-haul flights, you know, there may be some kind of risk there, but the short-haul ones, you're probably not exposed enough. But in the airport, this person must work at the airport. You know, coming into contact with people who aren't wearing masks and stuff, that is a risk, no matter where you are.
All right, and here's another question. Do you think there should be a questionnaire given to people who take the COVID test to try and narrow down the transmission instead of just closing bars and restaurants?
This is a good question. You know, this is what they do in universities. Like in my university and hospital, we have to go online and answer these 5 questions before we come for the day. That kind of stuff, it could be helpful, but I mean, after all what's going on in this pandemic at this point, people who have symptoms should not be not be out in public until they're diagnosed with whatever they have. So I'm not sure how effective that would be, and plus it's voluntary. If somebody wants to go have a drink in a bar and they have a little sniffle or a little bit of a sore throat, they may not. It's a voluntary what they answer. So I'm not sure it's that effective.
Well, thanks for being with us. If you have a question for the doctor, go to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. Have a good day.
Okay,
Thanks,
see you on
Doctor.
Friday.
Hey, Paul.
Hi, guys. Looking at cloudy skies across Chicagoland here this morning. You can see from our WeatherBug camera from Edgewater Beach looking south into the city.